they are doing here. I will not be sending the Arkansas State Police to the border. I have asked General Penn to evaluate a National Guard contingent and what that might involve, and that option is still open. We have to remember this is a little bit different. We did send our National Guard resources to the border under the request of the President of the United States a year or so ago, and the situation is worse at the border right now, and there is a need for resources there. But when you don't have the federal authorization, then you've got to worry about the chain of command. You've got to make sure that there's the right protocols in place and the right responsibilities, and whether we're doing support work and what it would be, and whether we have the right expertise to provide assistance. So we are evaluating that, but at this time we'll not be responding to that affirmatively through the Arkansas State Police. We have the 4th of July coming up, and as you can see, we did have an increase of cases subsequent to Memorial Day, and now we have the 4th of July coming up. And my caution to all Arkansans is, yes, you're going to travel, yes, you're going to the lake, yes, you're going to have your backyard cookout and the celebrations. I'll be joining in that as well. But at the same time, if you are not vaccinated and you're going to be participating in those activities, then please take the responsibility to take care of yourself. Don't add to the spread of the virus. We have the Delta variant predominant moving into that state in Arkansas, and we have to take that very seriously. It's more contagious. It has more consequences in terms of health, and so take care of yourself and follow the guidelines, which really is social distancing, wearing a mask if you have not been vaccinated. So the 4th of July, let's celebrate the founding of our country and our independence and have a good time with family. But let's be mindful that the variant and the virus is very much present in Arkansas, as you'll see from the cases that we will showcase here shortly. I want to talk about a bright spot of something that Arkansas has done, and that is each week every nursing home in America is required to report COVID-19 vaccinations that's been received by residents and staff. Last week, Arkansas nursing homes were determined to be the best in the SEC as it relates to residents and staff who have been vaccinated. The high vaccination rates has led to a drastic decline in COVID cases within these facilities. This is a great success story. A couple of illustrations of this: 78.5% of residents and 57% of staff in Arkansas facilities have received the vaccine. 2 Arkansas facilities, Highlands of Bella Vista and Colonel Glenn Health and Rehabilitation, have received 100% vaccination for their staff. And that reflects a lot of leadership, a lot of education, and I want to applaud their work, and also to applaud the work of the Arkansas Healthcare Association and the nursing homes in this state that have done so much to protect the elderly and to encourage vaccinations. I think they've done an excellent job. And now let's go to our case report for the last 24 hours. I would emphasize to everyone that while we're not doing a daily report on Saturday and Sunday, we will have the habit on Monday of releasing the daily report for the preceding days so that those who are keeping track can watch the trend line. But as you can see, from this graph, we have an increase of 479 cases over the last 24 hours. This is in rather modest testing, and during that same time, we've had an increase in our active cases. We have a decline in our hospitalizations, which is very good news, but we've had 6 more increase in ventilators. We've had 8 more Arkansans pass away as a result of COVID, which is a tragedy that we regret very much. In terms of our vaccinations, we're at 4,244, not where we want to be, And if you go to the next slide, you'll see the trend line for our confirmed and probable cases. And you can see that we dip down, and that's really low. That looks like we're still at a high level. We came down to a very low level, and you can see that we're inching back up. And so that should be a wake-up call. And then the next slide talks about vaccinations, which is how you get out of any slump or get out of any increase in cases. And here, this is the positivity rate. The positivity rate, again, you can see it's edging up to closer to 10%. So we don't like the positivity rate, the number of cases, and we know the Delta variant is present. And then we go to our vaccinations, though, and you can see here the number of daily administered, so in other words, first and boost shots that were given in June. And what I pay attention to is that line that's slanted across all of those bar graphs. And it's, whereas it started on the left about 5,500, as you can see, the trend has been down somewhat to about a little bit more than 5,000 on average. So, as you get more people vaccinated, it's going to be more challenging. So that's not too discouraging, but it shows that we've got to do all we can to increase that vaccination rate, because we're going to be getting closer to school. We're going to be getting closer to fall activities and indoor, and we've got to have a higher rate of vaccination as we move into that area. And then the next graph, I'm going to focus on some counties, but before I do that, let me talk about our vaccination rates. And you hear different ways to measure our vaccination rate. If you look at our entire population, we're at 39% of our entire population is vaccinated. If you look at our adult population, which is 18 plus, we're at 52.4% of our adult population that's received at least one dose. And then, of course, I have a goal of 50% of our entire population. But I wanted to point up, if you just look at our eligible population, which is 12 plus, and we compare it by counties, you can see the variation in our counties and their success rate. And so with that, let's look at our counties. And on the left, you see the top 5 counties, and these are eligible populations, 12 plus, that's received at least one dose. And here, congratulations to Bradley County, top county with 48.9%. So in a rural county, you can have a good vaccination rate. DeShay County the same way, 48.9%. And then what is really good news for us is in our high population counties, Washington, Pulaski, and Benton, they're above 46% to 47%. So those are high population numbers, really adds to it, and they're getting closer to 50% of the eligible population being vaccinated. If you look at our bottom 5 counties, and I want to give a little cover to them, but Calhoun County, 27%, Lafayette County, 27%, Lincoln over in eastern Arkansas, 27%, Fulton up in the north, 24%, and Miller County, 18%. I would add something that we've worked hard to get statistics from Texas, because some of Texarkana residents are going to be going to Texarkana, Texas, the hospital, and get their vaccination, and we've got to get that data and put it in, and we do try to do that, but I don't think we're capturing it all. And so that could be a gap for some of those southwestern counties, and I believe it's higher than that, and that could be true up in northern Arkansas and Fulton County as well, close to the Missouri line. But it still illustrates the disparity of our vaccination rates in different counties and how we all have to work to get up to a much higher level. And so with that, there's a final graph here on hospitalizations, and I'm going to cover this quickly, and then I'm going to let Dr. Patterson comment on it from his perspective as a healthcare professional and hospital administrator, chancellor, that 90.5% of our current active cases are not fully immunized. That should be an incentive. And since January 26, there have been 3,700 Arkansans hospitalized, and 98.3% of those were not immunized. There have been 988 deaths, and 99.6% of those were not immunized. Statistics and science tell the story as to what needs to be done, and that means that we need to continue to push the vaccination because that's the safest and quickest way out of this. Dr. Patterson.
Thank you, Governor Hutchinson, and good afternoon. As the governor just said, we are now going in the wrong direction yet again with COVID-19 infections here in the state of Arkansas. If you look at the number of patients who are severely compromised, patients who need mechanical ventilation, that number has more than tripled over the past 8 weeks here in the state of Arkansas. And with July 4th holiday coming up and eventually kids going back to school, we have to be concerned that this would be a trend that could continue. And if it does, it would appear that we may be in the beginning of the third surge of COVID-19 here in the state of Arkansas. As I talk to my colleagues across the state in hospitals, we are seeing evidence of resurgence in severe cases of COVID-19 in Northwest Arkansas, Mountain Home, Jonesboro, here in Central Arkansas. For the time being, the hospitals in Southern Arkansas seem to be doing better. We hope that that continues for them. But we all need to keep in mind that we may be headed back into the same situation that we were in over the winter when the ability of hospitals to provide care for all comers was severely compromised. At UAMS, we are seeing this in our facility. We have had to re-establish our surge plan and open up surge beds for patients with COVID-19. We've seen a substantial increase in the number of patients who are requiring mechanical ventilation. And over the past 6 weeks, we've had 4 patients at UAMS who were COVID-19 positive who have required heart-lung bypass for their treatment. Fortunately, all 4 of those have been weaned off heart-lung bypass and are in the process of recovering. But that goes to show that our patients now are trending sicker than they were a year ago. And in fact, they are also trending younger. We've had patients in their 20s who've required heart-lung bypass to manage their COVID-19 infections. So why is this happening? Well, I think that there are a couple of reasons why COVID-19 is looking different now, is looking more severe and is impacting a younger population. One is that the older population may be doing a better job of getting vaccinated. And that's a good thing, but it means that some of our younger folks may consider themselves bulletproof, and no one is bulletproof from COVID-19. But the other big factor here that Governor Hutchinson alluded to is the Delta variant. We had our first case of the Delta variant identified in Arkansas on May the 1st. At the present time, greater than 25% of the genomic isolates in the state of Arkansas are the Delta variant, and my anticipation is that within a week or two, the Delta variant will be over half of the cases of COVID-19 here in the state of Arkansas. Why is this important? Well, the Delta variant is about 70% more contagious. It's almost twice as easy, if I have it, for me to transmit it to you as the variants that were circulating a year ago. But more importantly, it attacks younger individuals and it produces much more severe disease. This is not losing your sense of smell and a bad case of flu. This is immediately coming into the hospital and being put on a ventilator. And like I said, we're seeing more and more patients with no other medical issues who are in their 40s, their 30s, even their 20s, who are being severely affected by the Delta variant. Governor Hutchinson talked about the vaccination rates. Let me put it in perspective. There are several hundred patients in the hospital here in Arkansas with COVID-19 infections. Their COVID-19 infections are severe enough for them to be in the hospital. If your concern is that the vaccine will cause problems for you, compare 300 COVID-19 positive patients in our hospitals versus 0 patients who are in our hospitals because of complications from the vaccine. The vaccine is safe. The vaccine is extraordinarily effective, as these data demonstrate. And the vaccine, as well as continued practicing social distancing and masking when that is necessary, are our pathways out of a third surge of COVID-19 here in the state of Arkansas.
Thank you, Dr. Patterson, and with that, we'll take any questions.
Given the limits that there are now on what the state can do in terms of restrictions like mask mandates, vaccine requirements, and that the incentives haven't seemed to be that effective in terms of encouraging people to get vaccinated, what strategies, what tools do you have left for managing this third surge that appears to be happening? And kind of follow up to that, is this getting to the point where you think you need to revisit the emergency declaration, whether to request that be reimposed?
No, the strategy is set. Everyone knows exactly what needs to be done. In addition, when you set the strategy, you follow through with the education, you follow through with the marketing, you make sure the vaccines are accessible. When we started out, there was a shortage of supply. There's no longer a shortage of supply. And so the strategies is set, the vaccines are accessible. What can you do in terms of encouraging that more? I don't think there's anything more the government can do except to be honest with everyone and that they see the reality. And reality is the best incentive. And that is whenever you see the Delta variant wreaking havoc and causing people to go to the hospital, that's a reality check and should encourage people to get vaccinated.
On the emergency declaration, do you think that needs to be revisited with the numbers going up?
No, I think that there's, the question on emergency declaration, is there some emergency action that needs to take place? And the answer is no. It's all set. We're managing this. We're working it. We're treating it seriously and doing all that we can, but I don't know of any emergency action that needs to be taken right now.
I have a question for Dr. Patterson. Could you elaborate more on the positive cases with the Delta variant with staff at UAMS, how many those quarantined, and kind of the implications of whether or not they are vaccinated and what that can mean for this variant?
Yes, I can give you a little bit of information. This is, I would say, directionally correct, not exactly precise. We had a number of our residents who have tested positive. Our residents move from one facility to another. So there's a requirement for them to be tested when they rotate from one facility to another. It's in the low teens, the number that were identified. These were all either minimally or for the most part asymptomatic individuals, and I believe that the vast majority of them were either partially or fully vaccinated. The good news is that because they were vaccinated, we don't have anyone with infections that are even severe enough that that they need to be monitored on a daily basis, and certainly nothing that is severe enough that requires hospitalization.
With the numbers increasing like they are, what was the reason for not releasing updates on the weekends on the numbers, and are you concerned that sends a message that that this is not an urgent matter?
We released the numbers over the weekend. We just did it on Tuesday, which is today. So today we released all the numbers, and I indicated that was an error, that we did not release those on Monday, and next Monday they'll be released for the weekend. Whenever you've been in 18 months in the pandemic, everybody knows what's going on. To continue to have that, you're talking about additional stress on the staff at the Department of Health that's been under the gun for a very, very long time. So that's part of the reasons, and it's also the fact that most of the states have gone to the same type of lesser reporting. You'll find in many states they don't even do it daily. They do it even during the week periodically. So I know that's a little bit of challenge, but we're keeping with the consistency of daily reporting, and on the weekend we'll catch it up on Monday so everybody will know exactly what it is every day.
As far as the programs that are meant to get more people out and vaccinated, the lottery program, for example, would you say it's working here in Arkansas? And if it's not, what would you do to change it?
You're talking about the level of vaccination?
In that lottery program as well.
I'm sorry, the last part?
The lottery program and the
Oh.
lottery texting information.
No, it has not been effective in greatly incentivizing people to do the vaccine. And I think there's a couple complicating factors. Because of our constitutional restrictions, we're not able to do a true health care lottery for everybody vaccinated that's immediate. It has to be worked through the Arkansas lottery, and that was a complicating factor. And so, to be an effective incentive, it has to be immediate gratification, and that was delayed in this instance. But even beyond that, Ohio, which probably had one of the most successful incentive programs, they canceled theirs. They canceled their lottery because it had an initial splash and effective period of time, but then it declined. And so I think you're seeing that nationwide. And so we'll be fulfilling our commitments there, but we don't see that as something we want to continue long term.
Would you say we're past the prime then for when that program is effective?
Yes. Yeah, we're past the prime. It's no longer getting the results that we want, and so it will be wound down.
Any thoughts about California banning state-funded travel to Arkansas because in response to LGBTQ legislation?
Well, you sort of just shrug your shoulders at California. We have so many Californians that are finding Arkansas a wonderful place to live. They're moving here, not only moving here, but businesses are moving here, expanding here that are California-based. And so California is losing their residents, and now the fact that they mandate their state employees not to come to Arkansas is not a significant factor, and I think they can spend their time doing something a little bit different than trying to be punitive for other states that make the decisions that each state makes based upon where they are and what the action the legislature takes.
Are you concerned at all that this might be a sign, though, of more economic fallout for the state if you start seeing private businesses not wanting to invest in Arkansas because of the anti-transgender laws here?
I do not. And you got to understand, I vetoed one of the bills, so it's not that I'm in an agreement with all the actions that were taken, but Florida is on their list. It's like 12 different states, and so that becomes only punitive to California when they take that kind of action and restricting their participation in conferences or sharing ideas that might occur in Florida or Arkansas or a multitude of other states. So I'm not worried about it at all. There does not seem to be any impact from that. I do worry about us doing the right thing, and that's the motivation we should have.
Did you expect any pushback like this, not just from California, but anything that could be in the future?
For example, sports. The NCAA, has threatened action. They haven't taken any action, and they're not going to take any action. And I evaluated that at the beginning, and it's proven not to be consequential at all, what the NCAA may or may not do. They haven't done anything. In terms of businesses, some of our business leaders have expressed concern about some of the bills that have been passed. I've expressed concern about it. But you don't, you overcome that by showing the diversity of our population, our welcoming nature, and you try to remedy these things as time goes on. So each one of them, for example, girls in sports, I signed. I think it is absolutely the right bill for this time that protects girls' sports and Title IX, and that'll be a debate that continues, but I think that was a good bill and it was a right bill. The health care was a different issue that I vetoed, and so we make our judgments, but I think we'll be misplaced and we haven't seen any indication that that's going to be adverse in terms of our economy.
Anything to make sure that we'll have enough capacity in the hospitals if we do see significant surge, especially after the 4th of July and going into the fall?
I mean, Dr. Patterson might comment on this. I know UAMS has set up their own COVID unit. The pressure that, from my talking to hospital administrators, comes from the delayed poor health that is looking for health care now. During the pandemic, so many things were put off, and so now they're coming back, and that's has been as much of the pressure on our healthcare system. And the COVID is a small part of that, but it still puts pressure on the system. And so each hospital is addressing it. We're looking at it daily. Dr. Patterson?
Yeah, I would just add one thing to what Governor Hutchinson said. We're now, getting close to being 18 months into this. And so we have a lot of people, a lot of frontline caregivers, nurses, physicians, who have been working long hours under dangerous conditions. And I think a lot of them are at the tail end of their resiliency. So my concern is that if we get back to numbers that that were similar to the numbers that we had in the winter, that will unfortunately be with our fourth quarter team rather than our first quarter team.
Do we have any questions remotely?
Yes, Governor, this is Samantha with KNWA. We're talking about the Delta variant circulating and becoming predominant in Arkansas, and the school year now is just around the corner. I know students will be going in without masks, and some aren't eligible for vaccines. What are your concerns for students going back to the classroom?
Well, I mean, first of all, there's a great concern if they don't go back to the classroom. I think we saw nationwide the challenges from a mental health standpoint, from an educational standpoint, and so there's a lot of different aspects to health. And so we need to be in the classroom in the fall. I think everybody understood how we did the right thing last year. We need to manage our way through this, and I'm hoping that, first of all, it should be the teachers are getting vaccinated. It's been available to them, everyone 12 plus, so that's a large part of our educational population. We're looking to see if the additional vaccinations are available for the other age group, but I feel very comfortable as far as starting school goes, and we'll have to see where we are at the beginning of school as to whether any particular precautions need to be put into place for those that might not have been vaccinated or might not be eligible to them yet. And Dr. Dillahay is on the line. Do you have anything to add to that, Dr. Dillahay?
I think you covered it very well, Governor. I do want to caution people about the Delta variant. And of course, we want to protect our children from being infected with it. And the best way to do that is for the older kids and all of the adults to get vaccinated. That is going to be one of the best strategies that we can employ to keep our schools open.
Do you anticipate any actions to protect students or teachers?
Well, the actions are
Governor,
in place.
I think that would be.
Go ahead, Dr. Dillahay.
No, I was just going to say, I think that's a question for you.
Well, the answer is that the way you protect teachers and staff is for everybody to be vaccinated, and the student population will add to it. So vaccination, as Dr. Delahaye said, is what is absolutely essential. And I applaud the schools. They've worked hard. They've had clinics in their schools, making it available for those that are eligible. And I think it's amazing how smart the kids are and how they can look at it themselves and make those decisions with their parents. So I think we'll be well prepared as we go into school. And if we need to take additional precautions, we'll take a look at those. Next question.
Yeah, Governor Jay over at KRK. You know, how can we sort of explain some of that ebb and flow in the vaccination? I mean, obviously things are sort of just trending downward, but it seems to kind of, you know, ebb and flow, and there seems to be some real major dips.
Well, it's one thing to figure it out, and the other thing is to know what to do about it. But I think the ebb and flow has been from everything from the normal hesitancy in vaccines to the pause with the J&J to then our case count became very low and people stopped worrying about it as much. And initially, of course, everybody who is anxious, and of course the older citizens, there was a drive to get them vaccinated, so those numbers were naturally high. And so now we're into the hard work every day. And Colonel Ader's here, who I haven't recognized, but he's doing that work. He prepared for this. He understood that there was going to be hard going as we got down to this stage of our vaccination program. And so it's about doctors encouraging their patients. It's about the employers educating and encouraging as well. All of those factors helps us to get back there. The ebb and flow, to me, is based upon the sense of urgency that Arkansans have. And we have to encourage that and to give them a reality check from time to time. All right, one final question.
Tomorrow is the last day of the fiscal year. Any news or related to tax collections or revenue forecasts?
Yes, that's the customary time when we review as to whether there should be an adjustment in the forecast. And I have worked closely, talked with Secretary Walther, and I've authorized Secretary Larry Walther to revise the FY21 forecast. And the key fact of that revision is that it will allow $86.6 million to flow into the Medicaid Trust Fund. And that is important for our future and to make sure that we have adequate funds in that trust fund for the health care of our low-income Arkansans. Transferring that $86.6 million will give our trust fund a balance of more than $600 million. It's the highest it's been. And so that's a very healthy Medicaid trust fund. And even with that, it will also allow our long-term reserve fund to be $1.22 billion, which is an incredible amount that, 20.9% of our total general revenue budget. So it really meets a goal that many have articulated, that we need to have this amount in our reserve fund to be able to have better bond ratings, or at least to have a chance of it. And so that's the reason for the forecast adjustment, and the impact of it will be over $1.2 billion in long-term reserve, plus over $600 million in our Medicaid trust fund. With that, thank you all for your attention today and your coverage of this. Thanks, Cam.